Okay, good afternoon, everyone. My name is Gina Ford. I'm the Communications Director for Prince George's County Executive Angela Also Brooks. We're here today making some very good announcements for some fundraising and some contributions that have been made that'll help us certainly close this food insecurity gap that our community has been unfortunately experiencing in the midst of this pandemic. So first, we'll hear from County Executive Angela Also Brooks, followed by our health officer, Dr. Carter, who will give an update on our surge planning, after which some brief words from County Council Chair Todd Turner, and then Derek Perkins, who's a Senior VP Market Executive from Bank of America, and then finally Radha Muthaya, the President and CEO of the Capital Area Food Bank.
Good afternoon, everyone. I certainly want to thank you for being here again this afternoon as I share some important updates regarding our efforts around COVID-19 in our community. This is so very distressing, and you will hear Dr. Carter give this information, but we now have more than 3,800 positive COVID cases in Virginia, as well as 141 deaths from the coronavirus, and we continue to pray for those who are ill, those who are suffering, and certainly offer our condolences for all of the families who are grieving right now, who have lost loved ones. I've said it before, and I will say it again, that those who have died, as well as those who are recovering, and it is so important to note that the people are recovering. And I think that's a note for our community as well, is that we have a good number of people who are recovering every day. We continue to be with them, and those who have lost their lives are our friends. These are our friends. These are our neighbors. These are our family members. And so this is so personal for all of us. And we just want to note that these are not statistics. Even though we come out here and talk about the numbers, it must be abundantly clear who we're talking about. And these are people we love and care for. I want to begin to personally express my appreciation for a number of people, starting with Dr. Ernest Carter, who you're going to hear from in a moment, the entire health department team who have just been absolutely heroic during this time. I also like to offer my personal thanks to all of our public safety officers, our Prince George's County employees, first responders, those who are bus drivers, the grocery store employees who have turned out to be heroes for sure in this, restaurant and food delivery workers, custodial staff, our utility workers, the doctors, nurses, and so many others who have absolutely held Prince George's County together during this crisis. And we just want to I want to begin by offering my very personal thank you to all of those individuals, as well as our paratransit operators who are doing the really amazing work of continuing to transport our dialysis patients to their medical appointments, as well as delivering meals to our homebound seniors who rely on those meals. They clean their buses daily to ensure that they have a safe and clean environment. And we're really, really grateful to all of them, as well as our highway maintenance staff who keep our county clean and our infrastructure in good repair daily. We must remember that all of these people are not faceless figures, but these are people who are fulfilling every day their duty to our county, and they were doing so long before this disease arrived. But we are so grateful to all of them who have been amazing during this unprecedented crisis that we are experiencing. These are people like Kathy Stosny, who's a unit manager for the Department of Family Services Aging and Disability Service Division. Kathy has been with us for over 20 years. She has been caring for our county's older residents along with her dedicated staff. And in partnership with the Department of Public Works and Transportation, Kathy and her team have delivered over 6,000 meals to our homebound seniors who rely on those meals. And so we want to acknowledge her and tell her how proud we are of Kathy and her team. People like Kashana and Michael Shackelford. Kashana has been a Prince George's County firefighter paramedic for the last 9 years. She works during a 24-hour shift to make sure that she's responding to the homes of our most sick patients. She tends to their needs and then transports them to our hospitals to make sure that they get the care that they need. Her husband, Michael, is also a firefighter paramedic with the department. He's a lieutenant in fire investigations, and that is the unit that is tasked with investigating who may be responsible for unfortunate cases involving fires. But the two of them together are parents to two young children. One is a child, a 5-year-old Eli, and then a son, Kai, who I understand will turn 2 next month. And the point is that the two of these individuals who go out every day and put their lives in jeopardy then have to return home to their own family. They're concerned that they may pass on this virus, and so I'm told they go into their laundry room, they sanitize everything before they're even able to greet their children. People like Nancy Ross, Prince George, who is a Hyattsville resident, an ICU nurse at Holy Cross Hospital, who is there right now during this crisis, caring for critically ill patients, COVID-19 patients. She is a wife and a mother to 4 young children, and she says that her best moment in the midst of this crisis so far has been the joy that she was able to feel when she called the family of one of her 74-year-old patients who had been on a ventilator for 13 days, and she was able to convey to that patient's husband of 50 years that his wife had actually awakened and that she was stable, and that that they believed they were going to be able to return her home to her family. So these are our heroes who have been on the front line. I want to acknowledge them before I go further and to say thank you so much for all that they do. Now, as one Prince George's, we can do our part to protect those who are on the front lines. You've heard me talk about the frontline workers, but there is something that we can do also to make sure that as they protect us, we also protect them. Remember that one of the best ways to do this is to continue to abide by the governor's order. This order was done for all of our protection, to ask us to please continue to stay home unless we have an essential function that we're out and about performing, asking us as well to continue to social distance. And let me just say to everyone listening, I know how impatient our citizens and residents feel, and they have done a beautiful job of social distancing and making sure you stay at home. I know this is a lot to ask, but we're still very much in the thick of this. We are not done yet. These numbers are still climbing, so we're very much still in the thick of this crisis, and the sooner we comply and continue to stay home and to social distance, the sooner this crisis and this storm will pass. And so to further protect public safety, I signed an executive order last week. All patrons of grocery stores, these large chain retail stores, and those who ride with public transportation are now required to wear the facial coverings in order to get into those stores and to get on the bus. And again, I know Prince Georgians have done a beautiful job of complying with that. I've noticed it myself, and I want to thank them. In addition, our health officer, Chief Health Officer Ernest Carter, Dr. Carter, issued an order in concert with my executive order, and that specifies that individuals must wear these facial coverings in all essential retail businesses. And so that means that we're talking not only about grocery stores, but remember that extends to pharmacies and residents who go into laundromats and liquor stores and other convenience stores, just to name a few. We want everyone to be safe. And all of these orders that we have put into place here in the county are consistent with the orders that the governor has issued for the state of Maryland. And I want to make sure also that everyone's clear, because some people were grumbling a bit about the fact that they thought they needed a mask. It is not a mask that you need. It is a facial covering. So that means that if you have a bandana, a scarf, even a T-shirt that you can put to wrap around your face before you go in the store or ride the bus, the doctors tell us that this will help us to slow the spread of the coronavirus, because there are a good number of individuals who are walking around asymptomatic, who pass on this virus unknowingly. And so wearing those facial coverings is so critical to make sure that even those who are asymptomatic are not passing on the virus as they go about. That's the same is true when you're in the store, not just the facial covering, but that you remember to maintain that distance, the 6-foot distance that will also help us to make sure we're not spreading the virus. And then as we approach the anticipated surge in COVID-19 cases, you heard us talk last week about the fact that we were expecting a surge in these cases. And in fact, we are seeing that. But what we said at that time is that we had a plan, and we were executing that plan, that we were prepared for the surge. And I want to thank everyone who's been involved in helping us to prepare our hospitals, our emergency management on this thing, Ronnie Gill and his team, to make sure that we were not only preparing our hospitals, but that we had the critical supplies that we need for frontline workers. We were doing the important work as well of making sure that our community had the information that they needed. And based on the latest data that we have, I have something very concerning that I want to share. Dr. Carter and his team have put together some numbers for us, and those numbers tell us the latest data is that men across all races have a higher mortality rate. This is very important information that we wanted to get across to you. Hispanic men represent 73% of deaths in their population. We know as well that white men represent 82% of the deaths in the population, in that population, and black men represent 62% of the deaths among African Americans. And so we know that this population is showing up at a greater level, and I wanted to pass on that information. We also know that African American men comprise 45% of all the deaths that we're seeing, although they only make up 29% of our population. And so, unfortunately, here we have seen some instances, and this is the point: do not wait to get medical care. The point is, do not wait. We're finding that a good number of our men, in particular, are waiting until the symptoms continue to escalate. And at that point, it is often too late. And so we've had a few cases where individuals have died at home. And so when you feel that the shortness of breath and the other symptoms that Dr. Carter is going to tell you about, we don't want you waiting. We want you to immediately seek out medical care and to get there quickly, because this thing is escalating very quickly and it's costing lives. I urge everyone, when you're feeling those symptoms, to reach out. And we've also made it possible now that you can text to 911. If you're unable to talk, you can simply text. This is something new that we have put in place to make sure that you can get to a hospital. If you're unable to talk, just simply text if you're not able to talk, and someone will be able to respond to you. We also know that the coronavirus is not only affecting the health of our community and residents, but it is also creating a rapidly growing food insecurity issue that we are so concerned about. Since the beginning of March, over 30,000 of our residents have filed unemployment claims. This is it is really just stunning for us. It really is. When before COVID-19 reached our county, we had just over 16,000 unemployed Prince Georgians. We now have 47,000 plus unemployed individuals in Prince George's County. And what this means is, even before the COVID pandemic, we also know that 62% of our county school children were in need of free and reduced lunch. And of course, this has also caused a strain in that regard, compounded some of the challenges that we were already facing with our young people, and the food insecurity is growing. There was a situation that many of you probably saw, and I'm going to tell you, this upset me so bad to see the lines of individuals who were not only in Prince George's County, but in Montgomery County at the Mega Mart on Friday. Well over 1,000 people were out there trying to get food, and they were concerned about how they would be able to provide for their families. And so I want you to know that if you are in need of food, you have some place to turn. You have some place to turn. We're making sure that we create opportunities to provide food to all who need it right now. And this is why we began a partnership with the World Central Kitchen on March 20th. That partnership has helped us to provide meals all across Prince George's County. World Kitchen is known for jumping into action around the globe to help where disaster strikes, and they have been here and responded to the emergency right in Prince George's County. And we want to thank World Central Kitchen for being such a wonderful partner to us. Now, since that partnership started a little over a month ago, the World Central Kitchen has worked in collaboration with some of our local restaurants like Sardi's. They'll be working as well with the Carolina Kitchen to provide over 10,000 meals to residents and communities across the county. These daily meals deliveries happen at Ebenezer AME Church, the Sanctuary, and also the Community of Hope. We're working also there in other places around the county, but we'll be working to expand our efforts and provide more access to these meals, because as unemployment continues to rise, we want to make sure that no one should feel concerned about the food supply and their ability to provide food for their family. We hope that this will continue to expand, and we want to just give our sincere thank you to the staff at the World Central Kitchen. Chef Jose Andres has really done an outstanding job. We want to send our very personal thank you to him. want to thank Phil Sardellis and his team at Sardis, who have provided over 2,000 of these meals to residents in Mount Rainier and College Park through their grocery delivery service. And our county is also ramping up not just to use the Rural Central Kitchen, but we're also working with organizations such as the Capital Area Food Bank, and they will be able to assist us in providing hundreds of thousands of residents across our county with meals. The food bank has put together a 90-day plan for Prince George's County to make sure that we're able to supply that need. And I want to thank the Capital Area Food Bank's president and CEO, Radha Muthaya, who's here and who will be speaking, for being with us today as we seek to work to provide food to everyone. I also want to thank the chair of the county council who is here today, Todd Turner. Thank him and his colleagues on the county council who have been amazing, who provided another $100,000 to help us in this effort. I also like to announce today that the amazing ladies of Links of the Prince George's County chapter of the Links Incorporated, I'm a proud member of that chapter, and they have committed, you can probably tell, right, since I gave you the amazing ladies, right, that they have provided $20,000 to this effort as well, to the Capital Area Food Bank. They've also donated 100 meals to frontline employees, with half going to Doctors Hospital and another half going to the Fort Washington Medical Adventist Hospital. I want to thank them for that. I also want to take a moment to thank the Washington Redskins. And Dan Snyder reached out over the weekend and said we had this need and wanted to ask for a donation for the Capital Area Food Bank. They did not hesitate, sent us $100,000 to help us feed Prince Georgians. And I want to also give a huge thank you to Bank of America. Bank of America really stepped up, and they have been so generous. And today we are really proud to announce that they will be donating $500,000, $500,000 to help the Capital Area Food Bank designated specifically for Prince George's County. So we want to thank the Prince George's County resident, Prince George's County's own Senior Vice President, Market Executive for Bank of America, Derek Perkins, who is joining us today, and want to thank Derek Perkins for his work and also for making sure that those critical funds, a contribution of $500,000, will go to the Capital Area Food Bank designated only for Prince George's County. And this will help us to fulfill a really tremendous need. I have also directed $1 million to go to rental assistance and emergency housing fund, because we heard from so many of our residents who are not only concerned about food insecurities, but we know as well that there are a good number who are concerned right today about how to make their rent payments. So I have directed $1 million for rental assistance and also for an emergency housing fund. So this has really been a team effort. Again, I want to thank everyone throughout government. I want to thank the county council for being tremendous partners, and all of the private donors who also work with us. And I want to let everyone know that we continue to have great news. For anyone who's able to help us, you have a role that you can play, and that is to either donate perishable, non-perishable food items. We still need baby supplies, hygiene products, toilet paper, paper towels, and for anyone who's able to donate those things for members of our community, you can do so by going to our website at mypgc.us to get involved. And so we are just so grateful. I want to thank Pastor Tony Lee and the Community of Hope. I also want to thank Clavin Flowers and Dreams Work, a nonprofit partner in Temple Hills. I want to thank Costello Wilson and Team PMG, a small business in Temple Hills. From them, we received a donation of 5,000 masks, 5,300 toilet paper, 1,000 gloves, and 100 all hand sanitizers. And this is just an example of how the community has stepped up to help us during this time. And I just want to thank them so much, as well as the Faith-Based Advisory Board, who gave us 295 masks to go to our Prince George's Police Department. So this continues to be a time that is hard for all of us. You've heard me say it again, but you know what? We are going to make it through to the other side of this. The coronavirus will not have the final say, and I am convinced more and more every day when I see the resilience that exists in Prince George's County. There's nothing like our community. The resilience and the care that has been demonstrated during this crisis. We are all not only rise and emerge from thank you so much to our community for your patience and your love. And again, to all of the essential workers who go out every day, put their lives on the line to make sure we can make it through this. We, in fact, need and stand behind you stronger than ever. So next, I'd like to introduce Dr. Ford, ask him to come up and give remarks about where we are with respect to the coronavirus, and there will be other speakers as well. Thank you.
Our loved ones, and affects us greatly. So all of our work is concentrated on making sure that we can slow this down. Every day, we're analyzing the state's COVID-19 peak projection modeling. That data helps us to plan for when we may reach the peak of the hospital size, and that's when the hospitals go over their current capacity. I can tell you we have not reached the peak yet. Our new case totals keep rising, as do our hospitalizations. Hospitals in temporary beds outside of their buildings. We're working with the state to provide hospitals across the county with 292 additional beds that are, they call them medical tents, but they're actually solid structures that have beds in them. These include ICU beds and acute care beds. These medical tents can provide more beds, more space to separate the very sick COVID patients from the other patients in the hospital. This week, our hospitals received an additional ventilator equipment and personal protection equipment, and we're constantly getting more in, and we're fighting to make sure that our hospitals have what they need. We're constantly monitoring the need for that equipment because the number of hospitalizations can quickly change. So we want to be sure we have enough. That's why we are gladly accepting donations from the public, things like surgical masks, medical gloves, gowns, other critical equipment for the front line. Hospitals are also scaling up their staffing. That is and will be a constant challenge. We're working very closely with the state to be sure that they have the staff. We're making sure hospitals can harness every resource available to them to maintain critical staffing as we work to flatten the curve. So when will we flatten the curve? No one knows that for sure. The state's current modeling suggests a peak mid to late May. But that can change, so we have to keep an eye on that. Based on the state's current modeling, our calculations show that we have the capacity to adequately handle the surge of COVID patients in Prince George's County. However, those projections can rapidly change. That's why we analyze and we recalculate the available data every day to ensure that our numbers stay on track. If we find we're coming up short, we adjust, we beef up our response, and we keep planning. And that's important for us to be sure that we can make sure we don't get in a situation like New York. The timing of our peak depends on, one, how rapidly we can get hospitalizations to go down and stay down, and to see consistent reduction in our daily death toll. Residents now play a huge role in this. The projections that we get are based on resident behavior. So the physical distancing efforts are what's important. And I can say cautiously that we've got encouraging signs that it's been working. So I'm going to say these things again. I know I repeat them a lot. We must continue to do the physical distancing, at least 6 feet from each other. We've been doing a good job. We do have the ability to go out and ask people to distance when they're going to the system. stay home as much as possible. If you got to go to the store, wear a face covering. It's the law. And it's important because it keeps you, if you should have COVID, from spreading it. And that's really important. Wash your hands and wash them a lot. Keep them out of your face. It's really important. You can put on gloves, but if you put them from the surface to your face that has COVID, you still get it. So wash your hands. That's important. Wash your surfaces. Keep your surfaces clean. Assume you and everybody around you in public is a silent COVID carrier. Make the assumption. You don't need a test for that. Protect yourself, and you have to protect your loved ones. And here's one of the most important messages I can pass along. If you're sick, if your symptoms are getting worse, be seen. You may even have had a test and waiting for the results. Don't wait for the results. You need to be seen if you're sick. That's important. And I can't overemphasize it. I just had a call last night. And they told me that my son is sick, but I'm waiting on the results. No, go to the emergency room. He's sick. He's breathing fast. He shouldn't be at home waiting for results. So that's important. I can't stress that enough. Can't wait. Our men are waiting too long. You can imagine why, but men have to stop that. Because you can die at home from COVID. COVID can rapidly get you. And we're not going to allow that to happen with our citizens. So this is especially true, especially if you have people who are having those signs like difficulty breathing, cough, and you feel sick. So the sooner patients get into care during the course of the illness, the better chance they have to avoid getting in the ICU. Thank you. I'm going to pass this on to Chairman Turner.
Thank you, Dr. Carter. Thank you, Madam County Executive. County Councilman Todd Turner, Chair of the Prince George's County Council. I just want to say, on behalf of my colleagues, my 10 other colleagues here in Prince George's County, we are one team, Prince George's. And we want to thank County Executive Also Brooks and her cabinet and the workers here in Prince George's County for the work that they do every day. So we also want to congratulate obviously Bank of America, as well as the Washington football team for their contribution today in order to address the issues of food security, insecurity, here in Prince George's County as our residents are still continuing to do this. The Prince George's County Council is a partner in this. As part of our annual budget each year, we set funds aside to support not-for-profit organizations here in Prince George's County that are providing services. And then over this fiscal year 2020, we've provided over $250,000 to not-for-profit organizations in Prince George's County that provide food services for the residents of Prince George's County. You heard one of those is obviously with the Capital Area Food Bank. That's $100,000. We've also provided $100,000 to Food and Friends to provide assistance to our residents here in Prince George's County. So as part of this trying to respond to COVID-19, the Prince George's County Council has established what we call an emergency special appropriations grant process. And this is for organizations that have received funding in the past and want to apply for additional funding in order to support activities, particularly related to food and other activities to respond to COVID-19. So all you have to do, if you've been an organization that received funding and you're planning to provide additional services, is to go to the Prince George's County Council website, which is pgccouncil.us, and look for our grants page, and you will see the application for the emergency special appropriations grant. In addition, County Executive Also Brooks submitted her proposed budget back in March, just as we were starting our response, and we will be undertaking our budget review for the fiscal year 2021 budget starting next week as the County Council. As part of that, it is our hope that we still have an opportunity for additional grants for those who want to apply starting in the next fiscal year, which starts July 1st. And so we also, on our grants page on the County Council website, we have a listing of how you can apply for those grants for the upcoming fiscal year once the budget is adopted, which we're required to do by June 1st each year. So I just want to say in my last comments, this is Team Prince George's County. We support fully County Executive Also Brooks, as well as her team and Dr. Carter and all our public safety personnel, as well as those who are working every single day. And I also do want to mention that the Prince George's County Food Equity Council, which is a not-for-profit organization that talks about food security issues generally in Prince George's County, assisting us in taking the lead in organizing both pantries and other food providers out there. My comment is to those particular not-for-profits that are providing, including Capital Area Food Bank, and to those volunteers, those employees and volunteers who are out there every single day. I know several of my colleagues have participated in food distribution over the last several weeks. And we will continue to do that and support you as best we can. And we want to thank our private partners as well as our faith-based communities for their efforts in order to address this crisis as well. So thank you, Madam County Executive, and I believe I'm turning it over to Mr. Perkins on behalf of Bank of America. Thank you.
Good afternoon. Thank you, County Executive Brooks. Thank you, Chair Turner. This is really less about us and the leadership team here at Bank of America in the region. This is really more about the work that the Capital Area Food Bank is doing every day, nonprofits around the region, first responders, and also city and county leaders. We're here to support the work that you guys are doing. I wanted to say, again, thanks for the things that you guys are doing, and I'm going to turn over to Rada.
Derek, thank you so much for that. And it's a pleasure to be here with everyone today. It goes without saying that these are incredibly extraordinary times that we're living through, and things are very difficult for every last person who's living through this pandemic. But they are especially hard, as the county executive has just said, for those who are living through this without adequate nourishment and adequate food. Before COVID-19, there were already about 400,000 people across the greater Washington area who are food insecure. So the definition that we use there is that those who are just uncertain where their next meal is going to come from. 120,000 of them reside here in Prince George's County. So as we look across the entire service area, the one county that had the most number of food insecure people to begin with was Prince George's County. And so we have, we've always been committed to being able to address the needs here. Now, what we're seeing here is both the pandemic play out, but also the impact of the economic slowdown as well. The county executive talked about unemployment claims just here in Prince George's County. We are tracking that very closely because, as you all know, there's a high degree of correlation between those unemployment claims, those who are likely to then be moving into poverty, and those who are going to be food insecure. So we know that as these unemployment claims rise, the demand for food and the need for food is only going to increase. Now, the Capital Area Food Bank has been in this community for about 40 years. Ironically, when we kicked off and opened our doors, it was because the faith community came together to say that there was one common theme that they were hearing, and that more and more people were in need of food. And that's when we opened our doors. We didn't expect and couldn't expect that as we embarked on our 40th year that this need would be even greater than ever before. In normal times, we provide about 32 million meals every year across this community. And across this community, we do it, and we can only do it and because of the strength of our network. So many organizations right here in Prince George's County, some faith-based, others independent, who are very much a part of our network in being able to get food to those who need it. Now, aside from our network, we've only been able to do the work we do because of strong relationships across the board and strong partners, be they in the private sector or in the government sector. We've always had a strong relationship with Prince George's County at the county council level as well as with the county executive. I have to say, though, that these last few weeks, the partnership has been stronger than it's ever been before, and thank you for that, County Executive also, Brooks. And it's been more vital as we come together to align our assets and our strengths. We want to make sure that we're working together so that we're not duplicating and we're ensuring a seamless way of being able to get food to those who need. Now, it's been particularly challenging these last few weeks because only half of our partner network has been open. Many of our local partners and many who are with faith-based institutions are supported by seniors who are volunteers. And for obvious reasons, many of them are vulnerable and not able to provide support. but we have been able to get, just as much food out in the community, and we attribute that very directly to the support that we've been getting from the county, as we've both been nimble to be quick to think about different ways of getting food out. In fact, I was with the county executive just a few weeks ago at a pop-up pantry where we were delivering food in boxes, which is, again, now the safest way to be able to minimize exposure for everyone and to be able to get people what they need. So we know that the county is very committed to supporting all of us in this region to get food to those who are in need. Now, in addition to government partners, we very much rely on our private sector partners. And Bank of America has played such an incredible role. They have been doing that for some time in our community and with the Capital Area Food Bank. And it's really interesting because the Bank of America thinks about themselves and their partners being really neighborhood builders. And I cannot think of a better time, Derek, for us to have you as a neighbor that helps build our community, especially here in Prince George's County. So we're thankful for ways in which they, the Redskins, the Lynx, and others have come together to help build this community. County Executive also Brooks mentioned a 90-day plan that we've put together. We have a 90-day plan. In the next couple of weeks, we'll release our full one-year plan for the next year. And it's clear that we are all going to continue to need to work together to be able to address this increased need that we are faced with now. Over the next 90 days, we've established that about $1.3 million is necessary for us to continue to purchase much of the food that we're going to need to provide to those in need. And I'm happy to say with the investments that have been announced today, we're more than halfway there. We're closing that gap, and we're hearing of others who are interested in stepping forward. So thank you so much for this partnership from the public sector as well as the private sector, and we look forward to doing what we need to do to support the residents here in Prince George's County. Thank you.
Okay, any questions?
Well, so as you know, our governor and more specifically our first lady really went about bringing an additional allotment, 500,000 new tests to Maryland, and I didn't waste any time and shot off a letter this morning to the governor asking that he put aside 90,000 of those tests for Prince George's County to increase our allotment. As we have the largest number of individuals who are testing positive, we'd like to see that Prince George's County be made a priority for those test kits. So we are expecting to see an increase in that allotment. We increased our capacity at the FedEx field just last week. We were testing 100 individuals each time we were there. We were able to increase that to 200. And we hope that we not only can increase the testing there, but we're planning to move over to Cheverly and to increase testing around the county. As you know, the testing is really critically important. And right now, we believe to some extent, some of the positives have a connection to who has access, who has a doctor. And so the testing, making it more and more available is important for us to get a better picture of where we need to work to stop the spread of the virus. Yeah, it's devastating. I can tell you it is, it really, I was very hurt to see the number of people who lined up at that Mega Mart. I've heard also, I know when Ebenezer AME handed out food on Allentown Road that the line went down Allentown Road into a school. And so we have to do more. I mean, that's really the message, is that we have to do more. I was there with Radha a few weeks ago where we handed out 600 boxes of food in 35 minutes. So the need is really great, but it just really does increase our resolve to make sure, we're going to make sure nobody's hungry in Prince George's County. And again, that's why I want to thank Bank of America, the Lynx, I want to thank Dan, the Redskins, who didn't hesitate, stepped right up, and also I directed another $500,000, I forgot to mention that, to this effort. So we want to make sure we do our part. we'll work with the Capital Area Food Bank and make decisions about how to move it around the county to make sure we're getting it to the areas where the need is the greatest. But we rely on the experts who work in food insecurities, as well as work with our own Office of Community Relations. And based on the information we get, we'll be moving it around the pantry around the county. Anita? Yes. Yeah, so what I can tell you is we have not received yet the lawsuit. I understand that one is forthcoming, but I can tell you that the correctional facility really has done everything they could to ensure the safety and well-being of the individuals we have there at the correctional facility, as well as the employees there. Well, let me just start by saying this. When I started as state's attorney in 2010, we had probably close to 1,800 individuals who were being held at that correctional facility. But because of the restorative justice practices that we implemented, we now have 500 and I believe 60 people in the correctional facility. So even before coronavirus, we did what we could to make sure we only held people in the correctional facility who needed to be in that correctional facility. And as of today, we're taking all kinds of measures. All of our inmates have face masks, for example. They're in private cells. They are only let out of the cells in groups of 10 to go about doing various things. They receive meals in those cells. Every one of the holding cells has soap. We don't use sanitizer because there's alcohol in it. We're also testing twice a day. Everybody in the facility is having their temperature taken at least twice a day. We have isolation areas for those who show signs or who are sick. So we are separating people, we're caring for people, and it's just a really difficult situation because, to be honest with you, the thing that is most challenging about a correctional facility is our employees have to go home. And when they go home, they interact with spouses who often don't realize they have the virus, passes it on, and then those individuals have to come back to work. So the entry point has really been that it's very challenging because you have people who are coming in and out to work, and that's the way that the virus has been spread. But the correctional facility has done everything it can to sanitize it. It's clean, and making sure that we're, practicing all of the advice we've gotten from our chief health officer, who's on the phone all week long with our director of corrections, because we know it's important. Let me just say this: the people who are in that correctional facility, like I said about everybody, those are people's family members. We don't take that lightly. We don't. The people who are working in that facility, the people who are held in that facility, have family members who care about them and their well-being, and we care about them too. So we're going to do our level best to care for their safety and well-being while they're in our